of an 18-year-old from Anne Arundel County changing the world.
Yeah, that's right. She's changing the way women in developing countries are screened for cervical cancer, and her work is actually being recognized on a national level. WMAR 2's Megan Knight has her story.
At the age of 18, Lena Goldstein is already quite the world traveler. And it was a year-long medical service trip with her family in South America and Southeast Asia that sparked an idea.
So hearing the stories, I think particularly of women whose reproductive health and women's health is stigmatized and who often don't have access, was really touching. And I was wondering why more women in the world hadn't been screened for cervical cancer.
She began reaching out to tech companies, doctors, and nonprofits, putting together teams to screen women for cervical cancer in developing countries. One of the biggest challenges of the project was convincing the women to trust Western medicine.
Global health is not just how can we help the most number of people with new technology in the shortest amount of time. It also has all of these social, religious complexities that can't be ignored.
The teams utilize the see and treat method, screening a woman using portable devices and delivering the results in hours, not days or weeks. Since starting this project in 2015, they've screened more than 6,000 women in Peru, Cambodia, and China.
It's an extraordinary feeling after the week or the 2 weeks or the month of cervical cancer screening to see the sheer number of people we've been able to reach.
Goldstein's work earned her the Diller Teen Tikkun Olam award this year, which recognizes Jewish teens who are making a difference. She is attending Yale this fall and plans to continue working on the project.
Because we want women to not only know that this technology and this protocol and this work can help save their lives, but also we want them to know why cervical cancer exists, what the root of the disease is, and we want them to be aware of future precautions that should be taken, especially if they test positive for high-risk HPV.
Goldstein says her teams are also exploring the full potential of telemedicine, such as allowing doctors to analyze results from anywhere in the world so they can screen even more women during their visits.